So the question has two parts. One, what to do with kids, and meaning really young kids, infants, and what to do with older kids. From an immunologist perspective, anybody who is 4 years of age is basically an adult because they have almost the same immune system as an adult. And so a person who already has allergies to certain foods, we have no choice but to avoid those foods. So we have to first identify what those foods are, and we have to avoid them until one can get the person desensitized. And so during this time, of course, the hospitals are all very much preoccupied with the COVID-19 patients, and it's also a very good way to acquire the infection if you don't already have it. So it's so people are being much more cautious in what to get exposed to, so that you avoid having to go to the emergency room. The good thing about the time we are in right now is that people are not going to restaurants that often. They're eating at home mostly, and so that reduces the risk of exposure. When you know exactly what you're making at home, then the risk goes down. So that's one of the beneficial side effect of the environment we're in. Now, in terms of how to address food allergies in kids. So the kid's immune system in the first 6 months of life, and to some extent in the early age, their immune system is developing. And so very few people are born with allergies. Allergies is an acquired condition. And so the question becomes, how do people acquire allergies? And the answer to that, like with most other things, it's a very complex question. And so there is a genetic predisposition, which combined with certain exposures and the environment, especially the gut environment, the microorganisms that live in our gut and elsewhere that affect our immune system and are contributing to whether somebody develops allergy to certain foods or not. And so early in life, having exposure to all the allergenic foods has been found to be beneficial. It reduces the risk of developing allergies. So in the past, the recommendation was, if you're, if you have risk of developing allergies, avoid peanut, avoid, milk and all those other highly allergenic foods. And that recommendation has changed completely. Now the recommendation is even at 6 months of age, you're supposed to introduce all these highly allergenic foods in your diet. So that's a very important thing to keep in mind. And then the second thing is the role of fiber in diet. And that's very, very important in allowing healthy bacteria to grow in your body and reduce the risk of allergies, reduce the risk of inflammatory diseases. So I want to really emphasize the role of fiber in that whole process.